pass along the opportunity for all of our rural facilities to utilize the 3RNet platform. So this is going to be a demonstration on how to use that and how your facility can use it in terms of recruiting for your rural facility. And then we'll also have a brief presentation by Anna, who is with our personal primary care division, to give y'all some very useful information. So I'm really looking forward to that. I do ask. I know there was some confusion with the links and getting those. So if possible, if you can put your name in the chat and what facility you're from, just so we can kind of keep tabs, and then that way, if we have any questions, we know who's all in attendance. But otherwise, like I said, if you'll have any questions, feel free to put something in the chat or raise your hand. But otherwise, I will pass it over to Mark to get started, and I'm looking forward to hear what you have to present to us, Mark.
All right. Thank you so much, Brandon. And thank you, everybody, for joining us today. My name is Mark Barkley. I am the Director of Member Services at 3RNet. And today we're going to spend some time looking at 3RNet from the perspective of an employer. So if you're out there in a critical access hospital, rural health clinic, FQHC, or any sort of other facility type, 3RNet is a national recruiting resource that has been around for actually just this year, 30 years. So we're celebrating our 30th anniversary. And what we really wanted to do today was kind of talk about the services that are offered to you through 3RNet by the Virginia State Office of Rural Health. So as Brandon alluded to earlier, if you have any questions during the course of today's training, this should probably take us about half an hour or so, at least for my portion. So we'll kind of walk through everything, explain how to get you set up. But if you have any questions, feel free just to throw them in the chat box. Okay. So I'm going to share my screen here. Just get set up. Okay, so this is 3rnet.org, and as I mentioned earlier, 3RNet, we've been around for 30 years, and we were founded as basically a national nonprofit network. So 3RNet is different than most kind of job boards or recruitment services that you might use. Essentially, how 3RNet works is we position one primary nonprofit coordinator in every state. So basically, it's almost like a franchise model. We have kind of one organization within each state, and then that organization basically kind of controls and runs 3RNet for their state. So for the state of Virginia, of course, we have the State Office of Rural Health, Brandon and Ann and Candy and their team. So basically, they're the ones that are providing all of this access to you. So as we'll cover throughout the course of today, 3RNet is a no-cost option for you. So there is no cost or fees to utilize 3RNet for your recruitment. Again, that is something that is all provided and covered to you by the Virginia State Office of Rural Health. So just a few things here to kind of get us started. So looking at our website, you can see we kind of brand ourselves as the nation's most trusted resource for health professionals seeking careers in rural and underserved areas. So we are very focused on not only rural areas, but again, urban underserved areas. And a lot of basically the candidates that we're finding. So just jumping back here a little bit, I'm based out of North Dakota. And so before I started working for 3RNet about 11 years ago, I was our North Dakota state coordinator. And so I was out in the state of North Dakota working with our residency programs, our training programs. I was actually employed by our School of Medicine. So basically, I was going all around the state of North Dakota, both locally and then also nationally to different career fairs. But I was using 3RNet as the central funnel for all of that. So any sort of health professional that I was talking to that was interested in loan repayment, J-1 visa waivers, just working in a rural area, I was funneling them to 3RNet. And I think where our network becomes very powerful is we have 54 of those people doing the exact same thing. So we have that one member in every state, and then we have kind of 4 other federal type of organizations that are also members. But basically, we have 54 coordinators all across the country working together to drive folks to 3RNet so that hopefully at the end of the day, you as the employer can connect with those folks and ultimately, have them take care of the patients in your community. So when we start looking at the job posting side of things, I think some of this will start to click, but just a few pointers here just to start off with. So 3RNet's not just for clinical professions. So you can see here, this is the interface that health professionals use to search for jobs. So you can see they can search from anything from acupuncture, dentist, nursing, any sort of front office, mental behavioral health, of course, primary care, NPs, PAs, but basically any sort of those jobs, any sort of opening that you have within your rural health organization. We want to, at least have an option for you to be able to kind of advertise that job on 3RNet. And then again, as we are kind of solely focused on rural and underserved areas, you can see we also allow health professionals to search by specific criteria that oftentimes they're looking for. So J1 visa eligible positions, for example, telehealth, loan repayment, of course, is a big one. We also allow 3RNet to be used for faculty and teaching positions, among other things. So again, once we get to kind of the interface where you as an employer will start posting your jobs, just keep in mind a little bit from this candidate perspective of what they see, because that can kind of guide us, I think, when we're posting our jobs to make sure that we're getting the most out of our postings. So this is how a health professional interacts with jobs. So for health professionals, basically they come to our website and they register with us. So all of the health professionals in our database, all of the folks that are going to be contacting you and that you're going to be contacting are all candidates that have chosen to register themselves on 3RNet. So we have about 90,000 active candidates in our database right now, and we have probably another 300 plus or so that register with us every month. So health professionals are hearing about us from our network coordinators. They're hearing about us because a lot of our coordinators are heavily involved in loan repayment programs, immigration programs. So again, they're finding us and then registering with us. And those are those candidates that you'll ultimately be able to interact with. But here's just a little bit of the information that they see when they're searching for jobs. They can do things like sign up for email alerts, again, reach out to you. And basically, once we get to that portion, any sort of information that you want to share related to your job, you will be able to share in your job postings on 3RNet. And again, you can have any number of job postings on 3RNet, and there's no cost associated with any of those job postings or placements because of the membership of the Virginia State Office of Rural Health. So with that being said, the first step as an employer, so if you don't already have a 3RNet account, the first thing to do would be to basically create that account. And this is basically an application process. So what you want to do is, if you aren't already registered with 3RNet, just at 3rnet.org up in the top right here, you can see this register employer button. Once you go through and fill out the information for your organization, of course, you'll indicate that you want to post jobs in Virginia. And then once you submit that, that application basically goes to the State Office of Rural Health for approval. And then once they approve you, you'll automatically be notified via email. And then that's kind of your call to action to log into 3RNet and start working within what we call the employer dashboard. So again, step one is, if you don't already have a 3RNet account, go to 3rnet.org, register employer, fill out this application, and then again, you should hear back from the state office very soon with an approval for your application. So then once you have that account created, you can log in here on the what I call kind of the public side of the website. But what I would suggest is just going right to the dashboard. So I'll go ahead and drop this link in the chat. So the employer dashboard I mentioned, this is where you're going to be kind of managing all of the different things that you're going to be doing within 3RNet. So once you have your account set up and it's approved, you can go to dashboard.3rnet.org, or of course you can just log in on 3rnet.org and it'll shoot you over here anyway. But I put in my username and password and get signed in. So this is the interface that you're primarily going to be working with. And so I think what I'll cover here over the next 15 minutes or so are really kind of the three core functions of what you'd be using 3RNet for. So first of all, posting your jobs, of course, posting your opportunities and what that looks like to get those posted, and then also kind of what happens when those job opportunities are posted. The second thing that we'll cover is a term that we use called referrals. So referrals is going to speak to those candidates that are interested in your positions that you can kind of proactively reach out to. So that's the second thing we'll cover. And then the third thing we'll briefly cover is just, of course, obviously as a national nonprofit that's very heavily invested in rural and underserved, communities, we have a lot of educational resources as well related to workforce issues in rural and underserved areas. So I'll make sure you guys know where to find those. So starting off with our job opportunities. So you can see when I'm logged in here, I'm on the summary dashboard, which is just showing me kind of a snapshot of a few of the things that we're going to be talking about here. To post a new opportunity, super easy, just under the job opportunities over here in the left-hand column, click add new opportunity. And I'm sure you guys have all used some sort of job board before, and maybe that's been 3RNet. So I won't go through this posting an opportunity kind of field by field, but I will highlight a few kind of suggestions that at least I would keep in mind from my perspective. So first of all, this job title field, this is really the field that a candidate's going to see first. It's going to really be their first impression of your opportunity. So whether this job is emailed to a candidate, whether they find it on our website by searching, whether they see it on the home page as a featured job, whatever, however they find this opportunity, that job title is going to be the first thing that they see and the first thing they kind of understand about your position. So I would tend to like to see something in there that's a little bit has a little bit of a marketing pitch to it, you know. So if you think, you know, outdoor recreation is one of your biggest benefits in your rural community, maybe you want to mention something about that. But instead of just posting, you know, looking for family medicine physician, you know, maybe talk a little bit about what you're kind of able to offer to a potential candidate in that job title field. Also, then everything in 3RNet is going to be based upon the opportunities that you have posted. So looking at this profession list, again, this is the same 300 plus professions and specialties that health professionals can register with us, so both clinical and non-clinical. But let's just use an example here of if you were going to post, say, a primary care physician position. So maybe you want to tag that as family medicine. Well, the way that 3RNet is set up is you can post a job and tag it as multiple professions and specialties. So if there's some overlap or some crossover in the type of professional that you're willing to consider, I would certainly recommend that you tag it as many as are kind of relevant to your posting. So again, this could be a situation that comes up when you're posting a primary care position. This could be for you're looking for a nurse practitioner or a physician assistant, you know, mental behavioral health. There's a lot of crossover. Maybe you're looking for a social worker or a substance abuse counselor. So really, I would be kind of generous in the professions that you mark as, because again, all of your exposure to health professionals is going to be based upon the positions that you have open and what professions those positions are listed as. And again, I'll talk about that here in a bit. So once we have our job title, we tag our professions, again, some demographic information here for location, your job details. This is going to be kind of that full information. So again, a lot of people might copy and paste something in here that you've used from a different resource. And you can do all of that, links, you know, call attention to certain things that you want to make kind of stand out. And then over here in the right-hand column, we have some additional information. So your HPSA score, size of your community and service population, and then keep an eye, remember, on those specific filters. So if you are eligible for some sort of loan repayment option, you know, I would make sure to indicate that. And any of these other kind of you know, rural and underserved specific benefits that we typically promote to health professionals. So basically then, again, what we've covered so far as a new employer, you would create your account on 3rnet.org. Once that account is approved, you'll be able to log into what we're looking at now, the dashboard, and start posting your opportunities. You can have as many opportunities active at one time as you would like at no cost. We talked about the job title and tagging the multiple professions here for our position. And then ultimately, so I'd fill out all of these required fields, and then I have two choices you can see down here at the bottom of the screen. Do I want to save and exit, or do I want to save and add additional information? So save and exit will just post your job with all of the required information. If you want to add more information about the community, about your benefits package, about you know, any sort of compensation information, you'll want to click save and add detail, and that will bring you to another page with additional options where you can have all sorts of information, contact information, social media information, links to your application, any of those things that you'd ultimately want to tie into your job. If you want to include kind of as much information as possible, click save and add detail, and that will bring you to kind of the next step of the process. So posting jobs, again, hopefully pretty easy, pretty straightforward for you guys. Let me now talk a little bit about what happens once you start posting jobs. So of course, the first thing that happens is, you know, when you post this job, it's going to go to our website. So it's going to go into that search interface that I showed you earlier where health professionals can go in and they can search and find your job on the public website. You'll also see we feature jobs on our homepage here. So the most recent jobs and featured jobs will show up on the homepage here. So that's another way that health professionals can see and interact with your positions. So that's kind of the first thing that happens is it goes live to the website. The second thing that happens is I mentioned all of those 90,000 plus candidates that we have in our database and the 300 plus that are registering with us new every month. Those health professionals all basically sign up for email blasts when they register with us. So the second thing that happens when you post an opportunity is the system is going to look at our candidate database and it's going to find all of the matches to your opportunity. And then it is automatically going to send them an email on your behalf saying, hey, a new job has been posted on 3RNet that matches the criteria you're looking for. So those matches are basically made on profession and specialty, and then the candidate state of interest. So the candidate would have to be the same profession and specialty of the job posting that you have active, and also interested in working in the state of Virginia. So that circles a little bit back around to why, just looking at that email blast functionality for a second, that kind of reinforces why it's important to tag our professions as such. Because, for example, if I was to remove internal medicine, the position is still going to get posted. It's still going to go to the website, but instead of being sent to all of the family medicine and internal medicine physicians in our database as an email blast, it's only going to be sent to the family medicine physician. So again, the more encompassing of professions that you are, kind of the greater reach you will have with health professionals. So that's the second thing that happens is that job is emailed out to you. The third thing, which is what we're going to cover next, is kind of the same process as those email blasts, but in reverse. So basically, the system will make you what we call candidate referrals. So the system is putting your job on the job board out there for people to find it and search for it. It's actively reaching out to health professionals to say, hey, here's a new job that you might be interested in. But then the system will also send you active health professionals that might be interested in the positions that you have posted. So the third thing that happens is based upon the job opportunities that you have active, you will be made candidate referrals. So those will be candidates from our database that match the criteria of your positions. And then those will be candidates that you're free to reach out to however you see fit, phone, email, review their CV, whatever sort of existing process that you guys have currently going on. The system will match you to candidates that are interested in those positions so that you can work through or work with them through the referral process. So that is what happens when you post a job. Again, you can have any number of jobs posted. There's a template feature kind of, so if you post a job and you simply want to copy it or add another job, you can easily do things like that. So let me kind of pause there and either via the chat box or if anybody wants to unmute themselves or raise their hand. Did we have any questions about anything at this point? Okay. So hearing no questions, so that was the first thing that I said you'd be kind of doing on the dashboard is adding those opportunities and editing and making changes to them. But that's really going to kind of set in motion the second piece that we're going to be talking about here, which are those candidate referrals. So the way that this process works is so typically every week, and the way that the system processes them is Tuesday morning. So for any job posting that you have active on the site, basically every Tuesday morning, the system will look at all of the candidates in our database and it will match them to your openings based upon, again, three kind of criteria. So of course, it will only match you to candidates for which you have open opportunities for. So if you only have, say, an RN job posted, you're only going to get RN candidate referrals. So the first criteria is the health professionals that the system refers to you have to match the profession and specialty of one of the jobs that you have posted. The second criteria, again, is they have to be interested in working in your state. So when candidates register with us, they indicate the states or the areas of the country they're interested in working. So all of the candidates that are referred to you have they themselves indicated that they're interested in working in Virginia. And then the third thing is the candidate has to have been active on 3RNet within the last 7 days. So active meaning the candidate has logged into 3RNet or they've newly registered with us and are basically using the website to actively search for jobs. So those are the three criteria that are going to be used for you. And then again, every Tuesday, the system will automatically look at all of the opportunities that you have posted, go into our database, find all of the candidate matches based upon those three things that I just talked about, and it will send you those candidate referrals, which will ultimately be displayed here on this referrals tab on your summary dashboard. So this will also trigger an email to you, so you don't have to, guess or remember to go in and check 3RNet for new referrals. Anytime a referral is made within the system, within 3RNet, you'll get an email about it saying, hey, you have new candidate referrals. And again, that's kind of your call to action to log into 3RNet and view and interact with these health professionals. So this is just, you can see kind of a dummy candidate referral record here, but just a few things to note here. If a candidate uploaded their CV when they registered with us, of course, you'll have access to that. Phone, email information, you can see, where they currently reside, what opportunity they were referred to you based upon. And then additionally, if you go into the actions button, you can view the full information about the candidate. So if they have additional information on their candidate profile within 3RNet that's not shown on this table view, you can view that all here. You can mark health professionals contacted. So this is more of just kind of an organizational tool. So for example, if I reached out to this test candidate today, I could mark them as contacted. So at least I have some basic record of when I had last talked to this person. So again, it's not necessarily an applicant tracking system by any means, but for the 3RNet portion of things, if you have, if you're getting 20, 50 plus candidate referrals every week, sometimes it's really helpful to have a running list of who you've contacted when. And then also under the actions button here, you can skip candidates. So if you talk to a candidate once and maybe they're not a match for you or they're not interested, you can skip that candidate. It will still you'll still have access to that person. It will just show up at the bottom of your screen. So if I was to skip any of these or this one candidate referral I have, basically a new section would pop up saying skip referrals. Again, you'd still have access to them, but it just kind of shows up in a different portion of the screen and lets you know that you've skipped that candidate in the past. Okay, so let me pause there again. So that's kind of the second big piece of the system. We talked about posting opportunities, how those are reaching candidates to their email inbox on the public website. And then on the flip side of things, we've talked about referrals now, where the candidate database is automatically making you matches based upon the opportunities that you have. And then each week you get a new list of candidates that you're able to reach out to. And again, of course, there are no costs associated with any of this. So if you happen to hire one of these candidates, that's great. We hired, there was about 3,700 health professionals that found their job through 3RNet last year. So again, we have a very proven track record of working with candidates that really are interested in working in rural and underserved areas. So, but if you happen to hire one of or multiple of these people based upon your 3RNet postings, again, we'd love to know that. The state office would love to know that because again, we have to justify the funding that of course we're getting from our federal partners and such, but there are no fees to you, of course, with any placements or job postings. But again, if you do have those success stories, those are very great for us to hear. Okay, any questions at this point on the referral process? Okay. And then finally, the third thing I mentioned to you guys that we'd be covering, again, as a nonprofit, we all know that recruiting in general, recruiting and retention workforce issues in general are are hard all over the country. But then when you kind of take that and you specifically look at rural and underserved areas, it becomes even more challenging. So there are a lot of educational resources out there around recruitment, retention, workforce. But again, we've used our 30 years of expertise to specifically tailor those or create our own resources for rural and underserved recruitment and retention. So recruiting to a critical access hospital that maybe has one person working HR as opposed to a huge health system are two very different things. So I would encourage you to take a look at this R4R Resource Center. Again, there's all sorts of educational resources and reference documents here to help you look at your process, help you look at your marketing, what you're putting out there, your job postings, and just making sure that you're being effective as you can be with all kind of portions of your overall recruitment process. So those would be the three things that I wanted to cover. Again, just a very quick summary recap. What we did was at 3rnet.org, if you don't already have an account, we registered as an employer. We filled out this application form. Once that application form is approved by your state office, you would be automatically notified via email, and you could log into the dashboard. And then on the dashboard, what we covered was posting opportunities. Again, you can have any number of jobs posted at any given time, both clinical and non-clinical. And then based upon those opportunities, you'll be made candidate referrals that you can reach out to. So candidates you can proactively speak to. And then, of course, hopefully reinforcing everything is the educational resources to, hopefully guide you a little bit on when you are communicating with candidates, what are some best practices, what do folks interested in rural and underserved areas want to hear about, what should you include in your job postings. So all of those kind of educational guidelines can be found under this R4R Resource Center. So I think that is everything I wanted to cover today. Was there any comments, questions? Brandon, was there anything that I missed?
No, this was great. Like I said, we'll get this recording out to everybody. I've dropped something in the chat if you've joined later. If you can, put your name and organization in the chat just so we can kind of keep a tally and make sure all necessary parties get the recording. But I did have something maybe for the collective group, if you want to kind of say like what are I guess like the benefits of this compared to traditional job boards or facilities finding more success using this rural specific platform. Maybe just kind of go into that before we get to Anna. Like I said, we still have a good bit of time left. So, and again, if anybody has any questions, feel free to jump in, but maybe just kind of give an overview on that since we have a little bit of time.
Sure. Yeah, so basically kind of the question being, what makes 3RNet unique compared to other job boards? Well, first of all, again, obviously this is provided as a no-cost resource for you. We are a federally funded organization. We are a 501c3 nonprofit. So again, we're not in the rural workforce area to make money. So I guess that would be the first thing is just kind of 3RNet as a national nonprofit. You don't see many nonprofit workforce or recruitment services. And then obviously with that, there's no cost for you as an employer to be able to use this. Second point, I think, again, goes back to those 54 network coordinators. So when I look at, let me just find an example here. When I look at kind of our network of folks, and I'll just jump into North Dakota since this is my home state where I'm located. If I scroll down here, you can see our current member, Stacy Kusler. So every state has a Stacy. And basically, again, Stacy works within our School of Medicine here at the University of North Dakota, and she's constantly out working with health professionals, working with, if any of you are familiar with Area Health Education Centers, AHEC programs. We actually have a partnership with the National AHEC organization for all of their AHEC scholars to register on 3RNet. So when you're looking at the types of candidates that are coming to 3RNet, I think if you're looking at other for-profit recruitment services, you're maybe starting from this very huge pot of candidates, but you really have to be specific and narrow down who's actually interested in working in a rural or underserved area. Whereas on 3RNet, the kind of opposite is true. People are self-selecting and self-registering on 3RNet because they're specifically interested in rural and underserved areas. And those health professionals that are working with folks like Stacy, again, Stacy's not a traditional recruiter. She's not a headhunter. She's just out there trying to provide information and education to those health professionals. So again, I think you see with the types of candidates that register on 3RNet, we get a very strong mission-focused candidate pool. And we really have a good, I think, reputation and word of mouth among folks because, again, of our nonprofit status. And our folks aren't trying to sell you or, pressure you into, doing anything. They're just trying to provide resources. So I think those, Brandon, would be probably the two biggest things that would jump out to me as far as what differentiates 3RNet from other kind of for-profit, recruitment resources. Again, we are a no cost solution. And then the type of health professionals that we're interacting with, it's a very grassroots organization. So we have representation out there across every state that are working every day to drive health professionals to 3RNet. So hopefully that covers maybe a little bit of what you were looking for, Brandon.
No, perfect. Thank you so much. Like I said, great for the overview. Um, is there, before we pass it over to Anna, is there anybody else that has any questions? Of course, I imagine we'll have some time at the end as well, but just wanted to kind of leave some room before we pivot a little bit.
Hey, this is Rachel Hunter from Ballot Health. I have a quick question. Do you all have any data on how many hits that you are getting on your site? And then, I mean, also, could you narrow that down to Virginia?
Yeah, so great question. So within your opportunity dashboard, you'll actually be able to see how many times your jobs have been viewed. So you can see you'll actually have a running number of views, and those views come from both health professionals that are registered and logged in with us, but also those that aren't. So it's not required for a candidate to be registered to be able to view your job. They just, if they're not registered with us, they kind of see just a snippet of information about it. So first of all, when you start posting your jobs, you will be able to see the specific amount of views toward each of your jobs that are posted. And then secondly, in terms of data, we publish an annual report every year. So this is 3rnet.org/impact was how I got here, and I can throw this in the chat too. As a national organization, we typically only publish national data. Your state level coordinators would certainly have access to Virginia level data if they were, willing and able to provide that to you. But as far as national data, you can see, and our next annual report for the last fiscal year 24 will be coming out probably within the next few weeks. But the numbers from last year, you can go through and see all of the information related to how many website visits we had, how many users, how many referrals were made through the system. That 3,700 number is the placements number that I talked about earlier. So 3,736 placements is what was reported through the website, basically hires. And then we even break it up by profession and specialty down a little bit lower. So again, you can see this is national data you can see from last year to kind of get some trends as far as what candidates are using 3RNet the most, what professions, and then again, any Virginia level information, you could certainly reach out to Brandon or Candy, and I could certainly help them provide that information. But once you start posting your jobs, you'll also have individual view information for each of those jobs that you have posted.
Great. Thank you for that information.
Yeah, thank you, Rachel. Any other questions?
Great. Well, like I said, feel free to drop anything in the chat if you have a question. But like I said, we have plenty of time left, and wanted to go ahead and pass it over to Anna, who's within our office, to go over some information that she's provided for all of us. So I think y'all can, Mark, you can probably pass it over to her if she's ready to share her screen.
So I have the little green share button. That means I'm good to go, right?
Yep, you should be good to go.
Sweet. All right. Come on. Share. I have so many different. So what I have been tasked to talk to you guys about today is our decision tools for our incentive programs. So you've got this fabulous site with 3RNet featured right here. And but right above it, we have on our Virginia Health Equity Incentive Programs, which I'll drop in the chat. We have a way to sort of help people with their recruitment and help people decide what program they want to work on or they want to apply for. So if you come down, it's in this little blue box. I've heard noises that we're going to zhuzh this up a little bit, but I think it's going to just stay on the right. And basically, we've got two that are actually for the providers or the providers in training. And then we've got the site, which is just a combination really of the other two. But so I will start with the site since that's our biggest represented group right now. So basically, you can search by program if you like. I think the best way to use these filters, we've got these 3 filters up here. You can do the different site types, and you can also do the site types, and you can also do provider types. So basically, the reason why I put this together is that between the federal government and the state government, we have at least 20 programs in play, and there is nothing to stop a provider from applying to multiple programs. The only rule is that you have to only accept one award. So if you say applied for the state loan repayment program and National Service Corps and you were approved for both, you would only be able to select one or the other. But it improves your chances. I'm always about the shotgun approach in terms of being able to decide what programs you can apply for. And I'm also thinking work smarter, not harder. So basically, these are all the different providers. I took all of the different programs and I took all the different providers and all the rules and have just basically just created this clearinghouse so that you can sort of navigate that. So I'll just go through an example. So we've got a registered nurse, and let's see, at a rural health clinic. So these are all the programs that are if you were at a rural health clinic as an RN, which programs would you be able to apply for? And so we've got National Health Service Corps' both of their rural health centric programs here. We've got their classic loan repayment program, their scholarship program, and the Virginia State Loan Repayment Program. And then you can sort of go through and see what rules that there are to follow. If you're looking for a site, this can be used for looking for a site. This could also be used for you've already gotten your job and you're there and you want to figure out which programs work best for you. I don't have a ton of information down here because I've got the hyperlinks for being able to look up more program information. I just figured that I kind of knew what made people decide I just know what most people will ask, what questions they'll ask me, like, what are the eligible facility types? What are the eligible provider types? Does it require a shortage designation? Not all of them do. And do you have to have a separate site certification? If you've ever dealt with National Health Service Corps, you know that there is a separate application period that a site has to go through, and they do it once every 3 years, and that must be in place before a provider at their site must apply for loan repayment. Whereas with the substance use disorder or the state loan repayment program or any of those other programs, you would not need to do a separate site certification. You might need to go in and check a box, but there's no separate, you can do that right before your provider applies. So I think that is just something I want to help people figure out, so that they can do their best work, and put their efforts of applying to things and have it be more targeted. Again, these are only Virginia state programs. This is not this fabulous national database that we've got with 3RNet. So this is only for Virginia providers. There are some national programs in there that would obviously apply nationally, but I want to be clear that it's just for Virginia. So yeah, there's not much more to say about it. I'm happy to take questions if there are any. We can also look at the other versions, which are essentially the same thing, looking at the various programs. Like this one is state mental hospitals and registered nurses, and these are for people who have already graduated. And then we have the student ones. This one is less interesting probably to the sites, but this is just explaining, which eligible training programs, and what type of scholarships are available. But that is basically what we have going on here. So, yes, questions, anyone? All right. Well, I have dropped that link in the chat, and I hope you guys get some use out of it.
Thanks, Anna, and obviously thank you for all the hard work that went into putting this together. I know it was probably very cumbersome to do so.
It was 2 years ago. I barely remember it. I just keep updating it now. Once you build it from the ground up, then you can just update it, and it's fine.
Well, we definitely appreciate it. And again, just drop it in the chat, and we can send it out in the follow-up email as well, which will have the recording to this. But we have some time left, so whether it's for Anna or Mark or for myself or Candy or anybody on our team, want to open it up to questions and see how we can best assist you.
I see one question in the chat. As far as registering as an employer, yep, you can register as an employer anytime. On 3RNet, I'm assuming, is the question here that we're asking. So remember, if you don't have a 3RNet account, all you have to do is just go to 3rnet.org, register employer, and again, I can throw this link in the chat too, and then you just fill out this quick form, and that will establish your employer account on 3RNet.
And once we register, then we can submit any positions we have open.
Yep.
Okay, cool.
Yep, absolutely. So once you register, it'll have you set up a username and password, and then that's what you'll use to access the dashboard. Yep. So then basically once you submit that application, it just goes right away over to Brandon and Candy's team. Once they get it approved, which usually happens very, very quickly, they're usually really on the ball with that. You'll get automatically notified via 3RNet, and then, yep, then you're free to start posting as many jobs and working with the candidates as we kind of outlined today.
That's great. How many, I might have missed it, our last meeting ran over. How many candidates do you have in the pipeline right now?
Yep, so we have about 90,000 active candidates in our database.
Wow.
And then about 300 that register with us new every month. So again, a lot of good candidates coming in from training programs, like Anna was just alluding to, folks looking for loan repayment, whether it's National Service Corps, state level. We have a federal partnership with the National AHEC organization, so we are getting the thousands of candidates that they train specifically for rural and underserved areas into 3RNet each year. So again, hopefully you'll be, it's a no-cost resource for you to use, and hopefully you can find some really good mission-minded candidates that are already kind of self-selected to want to work in rural and underserved areas.
Do you have an idea of the breakdown for physicians?
So I would say our physician numbers are about probably 40% of our overall registration.
Oh, wow.
And then, like I said, if you want to see specific information from last year, you can always go to internet.org/impact, yep, and look at that annual report.
Great, thank you.
Yeah, thank you.
Hey, Mark, I have a question.
Yeah.
Is there any way that like job postings on this site can be linked to like a systems like website, like if they have their jobs posted on, say, Riverside Health System, if they have jobs posted, if they can, is there any like linkage to this platform that exists?
Yep. So when you're looking at your opportunities, so I'll start with the most simple kind of answer is you can always share opportunities right from your employer dashboard. So if you wanted to share them, get a link, promote them that way, you can certainly do that. There is some other website connectivity that's available. So I'll just show you an example. So uh, we many different other kind of national rural health organizations basically use 3RNet to power their job board. So again, we don't scrape jobs from anywhere else. So if you post a job on Indeed, it's not going to just immediately show up on 3RNet. You actually have to post it on 3RNet. But again, a lot of our federal partners, like this is the National Association of Rural Health Clinics. The National Association of Rural Health Clinics, you can see, uses 3RNet for their job board. So basically what happens is if you post a rural health clinic position on 3RNet, not only will it do all of the things that we already talked about today, but it will also show up on this NARC website. And again, we have those partnerships with many different organizations, the National Association of Rural Mental Health, the National AHEC organization I mentioned. So again, you're not only advertising on 3RNet in that sense, but you're also getting exposure to a lot of these other kind of national, federally funded rural health organizations. And then I didn't talk about it today, but there is basically the ability for employers to take information and do this same thing on their own website. So, for example, if you don't have a good job board platform that you're using on your website, basically what you can do is by using 3RNet, you can take all of your jobs from 3RNet and automatically have them update on your website, like we're looking at now for NARC. But again, that's something that's a little bit more involved. And I would just say if anybody has any questions on that process or if that's a benefit for you, just reach out to me and I'd be happy to set up some time and help you kind of walk through the steps of getting that set up. And if anybody happens to be going to the NARC conference next week, which is in Oklahoma City, I will be there presenting on rural health workforce. So if you happen to be in Oklahoma City next week for the NARC conference, I'll have a table and also, again, be giving a little presentation. Make sure to come by and say hi.
Anybody else have any questions? Thank you again, Mark. This is very helpful. And, like I said, again, this is at no cost to your facility. So, we really want to make sure it's utilized to the max capacity. So, again, we're happy to answer any questions and get you all running on this. Great. Well, I won't take everybody's time. We will all hang on for a few minutes to see if anybody has any last minute questions or anything. But again, thank you everybody for attending. We'll send this out once it's all put together, as well as some of the links that were discussed in this. But again, appreciate everybody joining, and we'll all hang around for a few minutes to see if anybody has any questions.
Thanks, everybody.
So I got to bounce to another meeting. This is Anna, but I did put my email address in the chat along with the link to the stuff I showed. So
Perfect.
good
Thanks,
seeing
Anna.
everyone. Take care.
Thank you.
Bye.